probably heard the word hernia, but what actually causes it? And how do you know when it's something that you shouldn't ignore? Joining us is Dr. Thomas Gillespie. He's the director of the Dignity Health Hernia Institute. Welcome.
Hi, nice to meet you.
So great to meet you. Okay, I know men have them, women have them. Sometimes they don't seem very significant. Sometimes they're extremely serious. What is a hernia?
Well, a hernia is actually a hole. And it can be a hole in your abdominal wall. It could be a hole in your groin. And just to make it simple, your intestines are falling out of that hole. So you see a bulge, but I see a hole.
That sounds terrifying.
It kind of can be. And the hard part is they don't always hurt. They're uncomfortable. They cause core weakness. You're losing your balance. You don't understand why you can't, but it doesn't hurt. And so that's why a lot of people, they neglect them. And they grow and they get bigger and they need a bigger solution for a bigger problem. And so we're always like, when you recognize it, it needs to be solved. Think of it as like a hole in your roof or a cavity. You have a hole, it needs to be plugged and it needs to be fixed. But the question is how? And there are many, many ways to do it. Our job is to tailor the operation to the needs of the patient.
And what you're doing is different from almost anywhere in the country because you're able to do significant abdominal repair.
Yeah, we actually, so for the small hernia, that's going to be a hernia repair. But for the bigger ones, it's actually going to be what we call an abdominal wall reconstruction. Now, there are places across the country that do it, but we only do it. Like, I guess the way you would say is me and my partners, the only thing we do is hernia repair. So I'm 100% hernia repair, 100% abdominal wall reconstruction. And so the question is, when do you need a hernia repair? When do you need an abdominal wall reconstruction? And really, that's going to be based on your core health, right? So sometimes it's not just a hernia. And that's what we want people to understand. It's not just a hernia. Sometimes it's an abdominal core wall deficiency. You're weak, you've lost your balance. A lot of times you've had a surgery through a weak abdominal wall, and when they close that abdominal wall, it opened up. And it's going to get bigger and it's going to be spread. If we can get to it small, we can do a nice small hernia repair. But if you let it grow and it gets bigger and it's in the context of poor core health, in medicine we call it a diastasis. If you have a hole in a diastasis, then we need to reconstruct your abdominal wall because our goal is to get your core health back, to get your balance back, to reconstruct your life so you can go back and live the life you want to live. It takes time, it takes work, and it's not just surgery. There are so many more components to it.
Well, you mentioned that some people don't have pain. So how do you know? What symptoms do you look for other than maybe feeling off balance?
A bulge.
A bulge.
If you've got a bulge, come see me. And then what we're going to do is now we're going to do a deeper dive. We're going to evaluate your core strength. And if you have a core strength issue and you have a big hernia and you have a diastasis, we're going to do an abdominal reconstruction. And the interesting thing is we can now do this robotically. The things that used to be done big with big open incisions that you needed to be in the hospital for 5 to 7 days, we're getting people out in 24 hours. They are long surgeries. Sometimes they require 6 hours of surgery, but we can reconstruct the entire abdominal wall, and many times we don't even have to enter the abdomen. We can literally use our robotic platform to put our instruments into the abdominal wall, separate the abdominal wall into its components, bring the abdominal wall together in layers, and then we lay a piece of mesh in. And it's not the mesh you guys hear about. This is different mesh. This is, now we've figured mesh out in a way that it works. And we lay the mesh in between the layers of the abdominal wall. And then after some physical therapy, people are 300% stronger than they were before surgery. They get their balance back. They can walk upstairs. They can go to the gym. They can go out into the backyard and garden. So a lot of people who have been sitting in their chair are now getting out and living the life they want to live.
Well, thank you so much for doing this incredible work for people, giving them back their health span, their lifespan. How can people get in touch with you?
They can reach out. They can go online, really, Dignity Health Hernia Institute or Dignity Health. We're at St. Joseph's Hospital and Medical Center. We're the only hernia center of excellence in the state. We're the only robotic center of excellence in the state, and we were able to provide all the care patients need.
Thank you so much, doctor. That website is also right there on your screen. It was such a pleasure to meet you.
Oh, nice to meet you. Thank you very much.